We're going to compress our coverage of the beginning of the scenario to give us more time to examine the conclusion.
Now be careful with your equipment. Take care of your equipment.
The team started well, reminding each other about safety procedures, locating the patient, and establishing psychological support between the patient and a paramedic.
Jacob, can you hear me? My name's Carol. I'm going to be down there in a few minutes.
She briefly assesses the patient's condition as best she can determine it from her position above.
So we do observe a small cut on the forehead. That's correct.
The team rigs a hull system and lowers the paramedic into the space.
Down below?
Can you hear me? Lower slow. Jacob, my name's Joe. What's back up? Okay? As soon as we can. You see you breathing all right, so just be careful. Take good care of you.
Followed by a second rescuer to assist. A Stokes basket is eventually lowered into the space.
Careful, run the rim. Got the tag line ready? Coming down.
Assessment of the patient continues.
Captain!
Yes.
Still got a Cat 1 patient. I'm conscious, I'm responsive.
Okay.
Small cuts to the forehead, control the bleeding. No other information at this time.
Okay. I've got a butterfly coming down from the basket. Bill, Joe, y'all okay? Yeah. All right.
Safely around the patient. Jacob, we're going to have you out of here in a few minutes.
The patient is packaged and diamond lashed into the Stokes. The hull team re-rigs their mechanical advantage. At this point, there are approximately 20 minutes left. Now, let's watch the rest of the scenario, observing the significant events. Arnold Pena, lead instructor of American Emergency Response Training, an on-site industrial training organization, gives us a hand with the analysis.
The environment here is in a typical industrial application. The team is working around some catwalks. They're also working around a lot of industrial handrail. Industrial handrail always brings up a little bit of controversy when you do anchoring, rigging, and vertical work. There's a nice depiction of these guys kind of test out their anchors. The handrail we're looking at right there is probably not one of the more suitable handrails, but it just so happens the deck here that they show does have a nice continuously welded steel handrail. And this is where the majority of the rigging is taking place. The safety line system is running with the yellow rope, and the main line system is running on the blue rope. This is some edge protection coming out. Looks like the guys up on top have called for. Patient's already rigged up in a Stokes basket. This was a nice three-person test, kind of a tug-of-war little test when you have what's called a questionable anchor, and a handrail's kind of fall in that category. So a good three-person tug like that kind of reassures the team leader and the rest of the team that the one person that's going to be hoisted should substantially hold that load. This final bit of rigging, it looks like the hoisting mechanism or the hoisting process is going to be done by a piggyback haul system. The blue rope changes direction right directly behind this set of rigging and goes on back 90 degrees from the handrail, and look like they might have got about a 15-foot stroke. They're hanging an anchor strap, it looks like, with a carabiner and a rescue sender or a mechanical cam type device on the blue rope, and that's going to be their progress capture for the haul. Interesting approach, putting the rescue sender over the edge like this, but it does definitely get it out of the way of the haul team. And again, I think something happens on catwalks, you don't have a whole lot of space to work. The main line hasn't been attached to the bridle yet. They're retrieving it at this point to send down a piece of rope to make a lifting bridle for the Stokes basket. The initial entry crew did take a rope with them to do the initial lashing, and it looks like they're going to pick up a lifting bridle at this point. Kind of interesting about this is a piece of pre-cut cordage come down that this team is evidently keeps in their bag, and they're going to hand tie a bridle, which is something that a lot of teams don't do anymore. But it definitely shows their skill, if the ability to do that quickly and tie some neat knots and come up with a symmetrical system. We'll see during the lift here that they do a real nice job of getting a head-up position on that Stokes basket. Looks like maybe 20 or 30 foot cord.
Everybody work safe. Take care of your equipment. Watch your patient.
Sir, what do you want me to do, sir?
Communication's been outstanding with these guys. You can hear them kind of barking out the commands in a loud vocal voice, and then at the same time you're getting a reoccurrence of that. Whoever receives the command, they're making sure they copy that order. So very, very wonderful communications. Everybody should strive to be this good.
Centering. And raise. Raise the center. Forward, Captain.
All right, so the bridle's been put in place. It's a 4-point bridle. You can notice that where the blue line, the main line attaches, is well over the center torso of the body, which is going to give them that good center of gravity, and that's going to give them that head-up position during the lift process. Everybody's assuming their positions up here on top. The safety line's being manned. It looks to be a munter hitch coming off the far side of the handrail, and again, the piggyback system is going to be doing the lift. The hoisting process, something that we see here, just a little bit of jumpiness in the hoisting process, but again, that's very typical with a manual lift. And this piggyback system, it'll show in just a minute, I think it's being operated by one person, a 4-to-1 mechanical advantage. Looks like a pretty medium-sized person. The pause that you saw is probably a reset in that system. One of the big pros they got by hanging the mechanical advantage, the progress capture device over the edge, you saw not really any drop per se during that reset process. So when they came to a stop, the patient was static, and here they are slacking and resetting the system. And again, the short area they have to work by working on a catwalk like that, and they might have achieved, looks like about 12 or 15 foot of stroke in this piggyback system. So that's what they get per lift. And the lift just exceeds that by just a little bit, so it looks like maybe one reset. There's one gentleman on the haul team hitting that 4-to-1, but he's able to raise this load. It works out. It's really hard to get super smooth with that, but that's totally within the realms.
You need more, right? People have to come up high. Slow. He's only got about 3 feet.
The high point rigging occurred, looks like maybe 6 or 8 feet, maybe 10 feet above the initial platform they looked to land the patient on, so it worked out really nice. It would be extremely difficult to get this patient up and over the handrail, something that's hard to do with Stokes basket work, but when you can rig a high point, bring the patient into a level down below, it works out really nice. They're working to transfer the system over to a lower. More than likely, they've reset their piggyback. Instead of grabbing and pulling up, they've reset it short, so they can now use the mechanical advantage to lower the load. Person at the edge is activating the progress capture device to let release, and the safety system follows it down. Unique thing to a munter hitch is the munter hitch functions both ways real easily. And here's their landing on the deck. Good communication here, especially with these guys called out some increments so that the top crew knew exactly how far they were off the floor. They can tell when the ropes hit the bottom, and then these guys can immediately call for slack so that they can break these ropes loose. Notice the patient does have, looks like their head's been secured, and they have provided some eye protection for them. I think this is a really important thing to do when you're handling the ropes around these people. Everybody knows that most of the ropes are cut by a hot knife, which leaves a kind of a hot plastic sharp ends on the end of the rope, so that's a nice protection. Both rescuers now are put right back on the same system, main line, safety line. Got a little help on the haul team, it looks like now. And the rescuers are being hauled out. Something that this depicts really nicely is that yellow safety rope. Every team in the world across the country is going to try to really strive to keep these lines as tight as possible. That's the whole idea of running a 2-rope system, is that you have redundancy. So about 6 to 10 inches is the common thing that we try to strive for that. So you see that little bit of give, but that's the give and take. The team leader should have a close eye on that, and would be a showstopper to call stop in that operation if he sees excessive slack build up on that line.
Sorry, brother. You learn your best again, okay?
A little bit more weight on the rope this time. These guys actually are coming all the way back up to the original level, so they're not pendulum over where the Stokes basket landed. The rescuers are going all the way back up. Fortunately, these rescuers are conscious, alert, and oriented, and they're able to do a little climbing here on their own. Trying to break that 90-degree edge with a dead load like the Stokes is a little bit of work. It'd be kind of rough. Works out nice for these guys. Here comes the initial rescuer. I think this was the paramedic that made initial contact. First one in, last one out. A lot of obstacles in the way, so again, it's nice to have these people coherent enough to be able to guide themselves out. Working in this environment, typically, if you don't have the ability to manage yourself like that, you end up doing a lot of tagline work to try to keep positioned off those obstacles. This works out nice.
2 minutes, Captain.
Looks like almost 2/3 of the lift with one stroke of their system, so they were really close. But not a bad idea. One full pull and then one, looks like one reset gets them completely over the edge. The good, nice thing here is that this haul team is standing in one position. We try to really discourage people walking with the rope because you stand the possibility of a trip hazard. So if you stand in place and that hand-over-hand action that they were doing works out really well for a haul team. Well, I think anytime you deal with a Stokes basket, that's probably one of the more maybe involved patient packaging devices that you're going to deal with. You had 2-person entry. You definitely have a lot of obstacles, and you have some questionable anchors to deal with. So yeah, it makes it an involved scenario. I think it's something that takes a well-trained team to tackle that, handle it safely. Those guys took a real nice approach to it. Clean rigging, real simple setup on the Stokes basket, and 2 people in and out quick. It looked nice. Having the high point is definitely a saving grace for them.